All right, so we're at 3 past. We're gonna kick this off. The innovative strategies to mitigate staffing shortages at your practice webinar. It's Klara and locumtenens.com coming together here to chat about this challenge and what we've seen in the industry and how to address it. So we're gonna kick things off with a little introduction here. My name is Connor. So thanks everybody for joining today. We're very excited to have you here. We're also honored to have Alan Ashby here from locumtenens.com to help us discuss the various strategies that practices can take to manage staffing shortages in today's healthcare landscape. So as we're kicking it off, I'd love Alan to introduce himself and tell us a little bit about locumtenens.com.
Yeah, thanks, Connor. Like Connor said, I'm Alan Ashby. I'm the vice president of our primary care team at locumtenens.com. We're a 25, 26-year-old staffing agency located out of Alpharetta, Georgia, doing mainly temporary staffing for physicians and advanced practitioners in all 50 states, both on-site and via tele. And for pretty much all specialties, we've been doing this for a while. We've seen a lot of different climates and different changes in markets, from the recession in 2008 to most recently COVID, and then coming out of COVID. So excited to be here today and share what we've seen.
Nice. Thanks, Alan. And I'm Connor. I am the Senior Director of Demand Generation here at Klara, also your moderator for today's webinar. Between Dentsply Sirona and Klara, I've been working as a marketer in healthcare for the better part of about 4 years. I'm excited to be joining today to talk to you about staffing shortages. So let's kick it off. We're going to move here to the first slide and just go over the agenda really quick. Basically, we're going to be talking about the state of healthcare staffing as we move into 2022. And we're going to go through 3 different topics: recruiting new employees, retaining current employees, and also implementing technology to improve operational efficiency for those employees to get more out of them, enable them at their workforce. We'll save 10 minutes at the end after that 30-minute session for a open Q&A for the audience to get engaged. So let's kick it off. Starting off with the current state of healthcare. Nice. So starting it off, we have some quick facts here. 22 million US workers currently employed in the healthcare industry, accounting for about 14% of the nation's total workforce, so big number there. 2.6 million new healthcare jobs are also expected to be added from 2020 to 2030. That's a 16% growth. So not only is it a substantial amount of our jobs here, but it's also something that we expect to continue moving up and taking up more share. So let's take a look at the next slide here. Looking at projected physician shortages. With that being said, even though healthcare jobs are expected to grow, basically the contrast here is that there's also a growing shortage of physicians. I'll leave the slide up just for a moment in case you want to dig into the breakdown in specialties as it pertains to you and your work. And in the meantime, Alan, I'd love to ask you, can you tell us a little bit about, as the staffing expert here, what you've noticed in terms of availability for healthcare jobs in comparison to the overall shortages?
Thanks, Connor. I would tell you what I've noticed is there is no shortage of opportunities or jobs out there for clinicians. There's the shortage of clinicians, like this is clearly pointing out there. In my 13 years of doing this, you've seen kind of certain specialties where there's a shortage and a higher demand, and then others, it's been kind of cyclical. But really coming out of COVID, we've noticed it's just widespread across all specialties. In the cities, rural healthcare, pretty much everywhere is looking for physicians, advanced practitioners, nurses, and for all specialties and everything. So it's something we don't see slowing down, and only exacerbated coming out of the pandemic. So.
Right. Yeah, we're seeing the same thing. I'm sure that's why everyone's on the call. So what's causing these healthcare shortages? What we're going to be jumping into next. So quick fact here, COVID-19, obviously everyone is very aware of this pandemic. As of May 2021, 14% of physicians and advanced practitioners said they were still unemployed after being furloughed or laid off in 2020. So Alan, if I can ask you, can you tell us a bit about what you and your company have seen in regards to furloughs and layoffs since the start of the pandemic?
Yeah, I would say right when March of 2020 hit, we saw a massive layoff across all specialties all across the country, something that I think most physicians and clinicians felt, being in healthcare, they were probably immune to. I think I heard that from multiple specialists. They were just like, I didn't think it could happen in healthcare. I thought I'd always have a job. And it was a tough go for a while. You saw a lot of for-profit companies laying off entire staff. But now that we've kind of come and we're starting to get out of the pandemic, what's happened is there's this pent-up demand for in a backlog of cases. So now the hospitals, the clinics, they've laid off their staff, furloughed them, and all these patients are returning, and they're like, oh my gosh, and it's a land grab trying to catch clinicians. So it's completely different. I would say most that are still out of work are choosing to be out of work at this point. There's an opportunity out there for them.
Understood. Yeah, that definitely checks out. So looking into the next stage here, also burnout, right? It's not just this change in the landscape that you were just talking about, but it's also coming back to this demand, right? And so we know that 39% of clinicians have reported increased levels of stress and burnout due to the pandemic. We see this with PAs and nurses really across the board, anyone who's gone through this experience. The most burnout specialties really being oncology, hospital medicine, critical care medicine, and emergency medicine. For those of you who are on this call who relate to that or in those specialties, take note. So we're going to move in here. COVID-19 vaccine mandate. Another thing I think a lot of us are very familiar with. We are looking at about 1 to 8 out of 8 registered nurses and doctors are currently hesitating to get this, and it makes sense, right? We're talking about these mandates and how they're being an extra layer of hesitancy to come back into employment. We also have early retirement, right? Another factor that's a cause to this staffing shortage we're seeing in healthcare. Quick fun fact for the team here: more than 2 of every 5 active physicians in the U.S. will be 65 or older within the next decade. And I think I read this. There's the big growth of population that we've experienced is where we're having the opposite effect now, right? We're moving in the opposite direction. Even I think China is talking about looking at their population go down pretty sincerely or pretty significantly over the next decade or two, and that will impact us more. Let's move into the next reason we got here. And then increased demand from these aging patients, which is the other side of that same sword, right? So we know that during 2019 to 2034, the US population is projected to grow by 10.6 from 328 million to 363 million, with a projected 42.4% increase in those age 65 and above. So we also need to be able to supply that, right? Okay, and let's dig into a little bit here. Final note, it's important to understand that physician hiring in particular has quite the lead time, right? So family medicine, for example, on average takes up to 227 days to restaff. I'll leave this up for a moment again to the audience to dig into your individual specialty. But Alan, can you tell us again from your experience, is there anything that you'd like to add about why the hiring process takes so long for specific specialties and positions?
Well, I would say that, especially leading into 2020, one thing I noticed is the hiring process in general at most facilities was rather lengthy. It may be phone interview, then several on-site interviews, where it could take 3, 4, 5, 6 months just to vet a candidate out, and they haven't even started working yet. And we're still seeing facilities and hospital organizations kind of use these practices, which is at their disadvantage. Now, the ones who are willing to kind of reevaluate their hiring processes and practices are getting and landing the right candidates. But on the inverse of that, the other piece is the competition out there. The clinicians have so many opportunities, and more than ever, they're looking for the right opportunity and the right fit. They're looking for the work-life balance. They're looking for flexibility, location. Pay isn't even as big a driver anymore as it is some of the other things that we're seeing in the market. And then just the overall shortage. It was already short before COVID, but as you referenced earlier, the early retirement of physicians is a real thing we're seeing now. And one thing we're learning and have experienced is for every physician that left and retired early, you got to think that was the generation that worked 70 to 80 hours a week.
Yeah.
You're seeing a new generation come on of healthcare clinicians that want to do their 40 hours, go home, travel, do their thing. So essentially you need 2 physicians or 2 APs for every 1 physician you lost. So it's a real deal out there. So.
Yeah, I actually never kind of thought of it that way. That's a good point, the difference in the mentality of the workforce between now and then as well. So good point. All right, so now that we've addressed all the different causes for this challenge, Al and I are going to move into different strategies for managing this staffing shortage that we're seeing being so prominent in the market. So kicking us off here, first, Alan, take it away.
Yeah, absolutely. So, I mean, you have a couple of different options here, and obviously just recruit new employees. We've kind of talked about the challenges there, and we'll kind of hit a couple more down the road and kind of how you could do that in this environment. Keep the ones you have, which could be a challenge as well, because coming out of 2020, I think in 2020, everybody was just happy to have a job. But now coming out of 2020, people have reevaluated what they want from their lives. And they also know there are options out there, and they're willing to in essence, jump ship for the right opportunity, which is something, if you turn on the news, is not unique to healthcare. It's pretty much widespread across all industries. And then the other is take what we have and get better at what we're doing. So we'll look at the end at some strategies there on that. So next slide, please. So here, when you're thinking about recruiting, what are your options to get new people to or new associates to your organization? I mean, pretty much every health system has their own internal recruiting team. That's their job. They live it every day. There are online options, the job boards that are out there, and there are several that we'll look at there. Some databases that have really gained steam, and I know some that we personally use that are very helpful, and we'll hit some of those as well. And then your various outsourced events, the permanent staffing agencies that can kind of be an extension of your recruiting team, temporary staffing, which is kind of what we do. And then career fairs and events, which could be a mix of what your permanent recruiters do and some other things there. So next slide. So if you're looking at challenges here and pros and cons of recruiting, you're able to attract the people and really vet out the clinicians and the APs and the nurses that fit your culture. And you're able to vet them out through your process, make sure they're a good cultural fit. There's a lot out there to help your internal team, but it could get a little costly if for some of the other resources that you're using. I would say right now, one of the toughest things about recruiting and that we keep hitting is the competition for clinicians and advanced practitioners. It's really, really high right now. And then just the new, which I kind of referenced earlier, the new mentality of the workforce and what they're looking for out there. So what was a driver 2 or 3 years ago for clinicians, not the same as it is now. And if we're trying to pitch the same message we did 2 or 3 years ago, you're going to miss the boat to another opportunity that's out there. So next slide, please. So internal recruiting, I'm not going to read this whole slide because it's a lot there, but I think it literally tells you the story. That's a lot to do, and you got to think this is only for one position. And if you're like most healthcare organizations, you have multiple positions open and a finite amount of time. So a lot here. So you may move the needle a little bit, but it's going to be really challenging to move it on a wide scale. Next slide. The online healthcare job boards we discussed earlier, another great avenue that you have access to. Most do have a subscription fee, so you are going to have to pay some sort of nominal fee, whether it's per candidate, monthly, annually, whatever. And then there's going to be some scrubbing involved with that as well. So a little bit of time there that you're going to have to dedicate some resources to. And again, it's a very competitive landscape. I know our job board, we get 65 to 75,000 hits a month on just our job board. And you got to think you've got all that out there. So physicians know they've got options, and advanced practitioners know they have options of where they go. So next slide, please. This one here is the one, the intelligent data-driven databases is one that's starting to pick up steam and is really, we've seen some growth here. And I think this is a great one. I know we personally see a lot of return here for some of the specialist positions. So you got to think the surgeons, the ICU doctors, geriatricians, any of the IM subspecialties, gastroenterology. These are great resources for that because they hone in. It's a smaller subset of clinicians, and it really hones in on those people. Where it's not a great resource and where we haven't seen the return is for more of your general practitioner, primary care specialties, to where it's more of a wide, larger scale search. You really don't get your return there. Again, we see value because we do all specialties here, but if you're going after primary care, family medicine, it may not be the best resource for you.
Gotcha.
And then again, we talked about all the jobs and we listed all the stuff that your internal recruiting team could do. Well, you have an option to expand your manpower basically by hiring an outside healthcare staffing firm. They'll do the ad placements. They'll do the Doximity searches, or like the data-driven online databases. They'll post the jobs online. They'll make the phone calls. They'll do the mass emails. So you can really get an extension of yourself and get a wider net cast by doing that. Inverse is it's going to cost you some money. So some things to think through there. Next slide, please. And when you're really looking at this, I think there's two options. And I mean, it's pretty obvious. You've got the permanent side. So you have a permanent position, you go to a permanent staffing agency. Most are what's called retained. So meaning you're going to have to pay them an upfront retainer, non-refundable, to open the search. Within that, they're going to do some monthly marketing campaigns and stuff for you. And then there's also going to be a fee that comes with it if they actually place and fill the position. So you could get up into the tens of thousands of dollars there going that route. Or you have the contingency-based permanent staffing firm, and they're not going to charge you anything on the front end. But once they actually place a candidate with you, they would expect a payment. So that's the permanent side. I would say it's a great option to fill some positions, but if you have multiple positions out there, you're going to have to look at other options because there are a couple of risks there in just going that route. On the temporary side, I think this is actually morphed into a different world than it was 13 years ago when I started. The temporary world when I started 13 years ago was looked at mostly as like a band-aid. You've got somebody out on maternity leave, somebody's got FMLA, someone needs to take vacation to go to a conference. Let me get a locum tenens in here or a temporary clinician in here to fill that spot. Well, what we're seeing now is healthcare organizations really using this as a strategy on what's more of a not transactional, but transitional staffing place. So we talked about how long it takes to fill that permanent position. And we also talked about the competitiveness of the environment out there. They're using the locum tenens temporary staffing model as more of a longer term placeholder. For instance, we have family practitioners that may be on assignment for 1 year or more, and they essentially become invested in that community, invested in that staff. And it's a great option because you can get someone quickly. You have the flexibility of not being tied down to a contract if you are trying to vet the right candidate out. And it's also a great option for seasonality of your businesses. For instance, Florida and snowbirds, they may not have the volume in the summer, but in the winter, the hospital may need that. So versus hiring somebody full time, you bring them on temporarily. So, next slide.
So yeah, let's move into retaining current employees. Alan?
Yeah, absolutely. So if you're looking at this here and then the retaining the employees, I think there's a couple of things that we kind of mentioned earlier. Leading into 2020 and then even in 2020, people were just happy to have a job. So they were there, but they also had a lot of time on their hands to think about what they want long term. So in retaining the employee, I think we need to make sure that we're almost re-recruiting them and making sure we're doing some associate sat type stuff to make sure they're happy and they're engaged and the culture is what they're looking for, and having some of those career conversations with them, because otherwise they know there's options out there. They've got a chance to seek some of that stuff that you got to think people are calling them and wooing them to their positions. So that's one thing I'd definitely say. One thing here too, we highlight increasing staff hours and burnout. That's one that I'm seeing a lot, especially in the ICU world, emergency medicine, critical care, urgent cares and things. So we're seeing not only are they trying to increase the number of shifts or days that they're working, but they're also increasing the number of patients they may see in that shift. So not only are they working more during the month, but they're also working harder with every day that they work. And that's a recipe for disaster, especially coming out of a COVID stressful world where it's been this pandemic world. They can only take it for so long, and we're starting to see, we've actually had jobs open within the past few months of physicians to where they're now getting sick, not from COVID, but from other things, because it's just caught up with them. Their body's just saying, you've got to rest, you've got to take a second. So that's one to manage. They can only take it for so long. And we call a lot of clients and are like, you know what, our clinicians are just going to pick up the extra slack. You risk actually going from one vacancy to 3, 4, 5 because you burn out your physicians or your APs. And either they seek other places or they're out on FMLA. Yeah. So you got to make sure there's that balance there of the quality over the quantity.
Something I'm just thinking of to kind of color this in a little bit is my life partner is actually in the other room right now taking an interview to translate into a tech role and move into software or tech like us. And she's been a traveling nurse for the better part of 6 years, right? Yes. So she's lived through this event, and I think she's has told me some horror stories about what it was like doing this and the breadth of COVID and now coming back, the staffing shortage that you're talking about. She'll take a contract and walk in and unexpectedly have 3 or 4 or 5 times the amount of patients she's supposed to be servicing, right? And there's no med tech, right? So now you're doing 2 persons jobs for 5 persons, 5 nurses are needed, and they don't let you go until the backfill comes in, and maybe they don't even show, right? Because they're going through the same thing. Exhaustion translates very thoroughly. I think it's a very good point to everybody who's working in this space. So absolutely. Definitely there.
All right, so I would say when you're thinking through how can you be competitive and what's driving clinicians to seek new positions or either what they're looking for in the market, it's always going to be, you're going to have the comp piece to it, but really what we're really seeing now is that flexible schedule and work-life balance. It's interesting to me because I started in our surgery world, moved over to emergency medicine here, and now I'm over our primary care team. Each one's got its own little different nuances. The doctors have their own little personalities and stereotypes, but they all want this. This is what they all want now. Even your primary care doctor who used to just want to do 8 to 5, Monday to Friday, they're looking for schedules where they can do a 1 week on, 1 week off, similar to what hospitalists do. And they're running after these opportunities and in some cases taking less money because they know that quality of life is so important to them. So this is something that is not on your radar, you've got to make it on your radar because it's not going away. We're seeing it everywhere.
Yeah, makes perfect sense. Flexibility in workforce, again, for us in tech, working from home has been a huge shift in the market that I would never go back into an office too. So work flexibility, I'm sure, translates to them as well. Ooh. So next, we're moving into improving operational efficiency. I skipped the header slide here, but I'm not going to look back. This is going to shift into my court. So we're going to talk a little bit here that there's basically many steps in the patient journey, right? Alan just talked about 2 different ways that you can handle the staffing shortages. You can also do this with tech, right? And so in these many steps in the patient journey, each of these steps often represents some manual labor that your staff is going to have to address. It can be scheduling, intake, voicemails, paperwork, goes on, right? These manual tasks are not only really cumbersome, but they can take your limited time staff, this smaller percentage of staff, their attention away from focusing on actual patient care, which is going to hurt your patient outcomes as well. And I know that's something that everybody here on the phone cares about. And as patients, I've experienced it too. I'm sure we all have, being able to get access, right? So what does that look like? It looks kind of like this, right? So why is this? It's primarily, I think, because workflows in healthcare are just broken. We have this slide here to demonstrate really how disjointed a patient journey can be, right? I use this example of something I just ran into a few weeks ago. It's very simple, but I'm trying to refill a prescription, right? So I'm calling my primary care. I played phone tag with them. I think it took 3 dials from me over the period of a week to try and connect with someone. I'm leaving voicemails every time takes them 3 dials to get back to me. And I really want this prescription. So I'm leaving the voicemails in multiple departments as well, even where I'm not supposed to, right? And so it just creates what you see on the slide. And the output of this is that it's going to impact my well-being, right? I need this prescription. And it's going to add unnecessary time demands for the practice's staffing. They now have voicemails from me over week 3 for maybe 2 different departments each, total of 6. They're listening to them, calling me back, right? And it just, it also finally represents potential risk of me migrating to a different primary care, right? If I don't get this prescription in a week or 2, I'm going to go find someone else that can work with me and have a better patient service. And that represents potentially lost revenue for this primary care. And I'm telling them while I'm in there, and they're receiving the information they know, and it's because they're short-staffed, right? It's everyone knows that that's the system. And so what we're going to talk about is how to get more out of less staff to increase operational efficiency with software. So I'm going to dig into that now a little bit. So basically, we're going to talk about how inefficient administrative workflows lead to wasted time and money. We just went through an example just now, and to bake that out to stats here for you, we have 70% of physicians who spend at least 10 hours a week on patient paperwork and administration, with 32% of physicians spending more than 20 hours a week, right? And that's insane. That's every single hour is them not being by a patient side, actually performing care. And busy work costs physicians an average of $50,000 in revenue as well, right? That translates right over, just to give you some gravity of the situation here. So running through the pros and cons is that technology is currently revolutionizing healthcare, right? We have a very slow moving industry now with short staffing, and it more than ever needs this type of attention. And so that's what we're seeing medical technology do come in here, spring up more than ever. Like there's tons, the market is so noisy with them. We're seeing more features from EHRs being rolled out than ever. They're exploding. And we're also seeing public markets just jump, right? Look at what happened with Teladoc. They're the small little company, and all of a sudden COVID hits and they went up 10, 20, 30x on the market, right? And that's because there's a demand and need for it. These things are coming now. So, and why is this, right? On this pros and cons list, it increases productivity. It's just that simple, right? And that explanation I was giving before, if you can migrate those 6-9 calls and voicemails to an open line of text, it's just one single conversation, right? It's an example of software and how it's changing. Lots of providers will now be able to communicate via text, and they've removed that phone tag issue and the voicemail issue and all that. So it automates routing tasks as well, right? If you have an open line of communication with your PA, for example, and you instead of calling in and having to get routed to them, you can just pick up your phone and reply to them. It goes right to the person you're already talking to. Provides flexibility in the workplace by enabling remote work, right? Now, if someone's really just an administration staff and they don't need to be in the office, lots of this can be done at home. And for me, I was talking about how I don't want to go back into the office. I love working at home. I make real good coffee, right? So I love being here. And I think that translates over to a lot of different industries, including administration staff at these locations. It also kind of opens up the amount of people you might be able to hire. If someone's not getting their vaccine, for example, and they don't want to go into work because of it, they can work it as an administrative staff with this type of technology, right? And it also provides staff with more time to focus on the patient experience, which is the thing that I think we all care about most, right? Like getting rid of these tasks that are very manual, creating these automations saves you time, and that time makes every single individual staff member, whether they're administrative or a clinician, more effective to be able to focus on patient experiences, to see more patients at a time. The negatives that people will usually look at this as like, hey, it's an additional cost, right? Now there's an onboarding period. You have to train people. There's a learning curve, right? And that's usually the way that people will unpack or evaluate whether or not it's a worthy investment for them. So we're going to dig in here a little bit on streamlining and automating routine tasks, right? So we can save time this way. Medical practices are able to get back that time, right? And in addition, selecting technology platforms that work together will take your operational efficiency to the next level. I see, we're talking about how there's a million of these solutions in the market, and a lot of them will do one or two things. And now you're migrating between softwares all the time. Not all of them will sync with your EHRs. That creates its own problem. Like if you're still scanning and uploading components of patient intake because we're dragging and dropping PDFs from one software into another. So it's important to make sure that you're working with softwares that are consolidated and do this well. With the right tech stack for your practice, you can enable less staff members to do more work with a given amount of time, which is helpful during staff shortages. So again, if you're using 5 to 10 different softwares and they're not playing nice with each other, you're going to end up doing the same amount of manual work that you would have if you're doing it with a physical piece of paper or in person or with phones, right? So throughout the next couple of slides, I'm going to talk us through some examples of how to save time with technology and streamline, like we're looking at this slide here now, so that it's not an exhaustive list of different softwares that you're using, and that these examples are primarily supposed to help you with figuring out which steps in the patient journey are wasting the most time for your practice. Cool. And so there are plenty of solutions on the market. Definitely going to be very clear about that to help you accomplish this type of fix, but I'm shamelessly going to use Klara because this is the access to imagery I have the best here to walk you through it. So this will be our visual example. So first, just allowing patients to schedule appointments online, making sure maybe they come to their website, they're net new, or maybe they're pre-existing and they're calling back in. If you migrate these conversations to a text feed, they can do it just like this and see the availability on your calendar and book it. And you never have to have an admin staff actually even pick up the phone. Scheduling is probably half of the calls that a lot of us receive for incoming is net new, or like we're talking about, or existing patients coming in for another visit. Just imagine the time that you can save that staff by removing that flow from there every day, right? So definitely something to be saved there. Also, I want to point out you can reduce time on phone by converting these calls to messaging in other ways too, right? So 7 days before the visit, you can do your appointment reminders, right? I think a lot of us at this point have appointment reminder software, but again, this goes back to that slide we were talking about where there's a lot of people who have one software for one thing and you have 5 different things and you have 5 different softwares, right? So if they don't speak all the way together, a lot of times that can create even more work. An example of this that I see very often is when people reschedule and the appointment reminders still go out, right? That can be for a couple of reasons. It can be because those 2 features live in 2 different softwares, or it's because the software isn't that great and it only updates overnight or something like that, right? So I see a lot of that in the market where it can get a little frustrating. Someone is rescheduled, then they still get the reminder for a time they're not supposed to be there, or vice versa, they just don't get it at all. So 2 days before a visit here, we can see patients get a prompt via text. You can even do insurance collection, right? Which is good. So now you're taking the next step off of the plate. Instead of having a line of people in front of this administrative staff who's also fielding phones, and this line of people is trying to get insurance uploaded to the HR, making sure it's a good fit, you can just do it over the phone. And again, this workflow automation, it sends out by itself. Hey, they're coming in 2 days. The system will recognize this. It'll replace that manual task by sending that information out, and the patient takes care of it, right? So it's automatically all taken care of. It removes that in-office burden. And then, of course, 1 day before visit, you can also do things like pre-visit instructions, right? Like maybe don't eat before this particular meet, right? Or whatever it is. So definitely a bunch of things you can do to really simplify the upfront patient process before they're in office. You can also read minute-long voicemails in seconds with voicemail transcription. Back to that original example. I'm an annoying patient. I want my prescription, right? I will call every 2 days and leave a voicemail, and I'll go through your phone tree and leave it on, the PA. I'll leave it on the admin staff up front because the PA is not getting back to me. And now they've got 6 voicemails, 2 different departments are listening to in a week. That's a lot, right? And you sit, you listen, they're 2 minutes long because I want that prescription. If I had a text stream like this, it helps. But if I'm still leaving this voicemail, transcribing it to text also helps as well, right? And this essentially saves you from sitting and listening to what's, sometimes at the end of the day can be hours of voicemails. You can read through 10 in 30 minutes, right? So it definitely represents another way to save time. And what this time does is it lets you see more patients, right? Not only provide better care for those who are trying to come in, who need immediate access, like me, trying to get the prescription, or the people who are in office who need your attention now, but in general, saving time helps you see more patients and reduce in-office time with telemedicine and remote patient monitoring. So see more patients, reduce waiting room times, gets rid of that line in front of the admin staff, reduce no-show for appointments. It lets you streamline workflows across departments by triaging, which is great because it's not just patient-to-patient communication, it's also internal. You can talk about that patient privately with other doctors in the office if you need to communicate like their state of care. Provides flexibility in scheduling for the patient, and of course enables remote work as we mentioned. So lots of benefits. And just to show you really quick, coordinating care with external providers and pharmacies can also be done. So it's not just internal triaging, it's external triaging. Here's an example of this again, like back to that same visit that I was talking about. When I was there, I brought up some other medical problems I wanted to address. And as a result, I received two different referral services. I won't tell you which, but I got their names and their phones. And I get it on a piece of paper, right, in doctor handwriting, which we all know is almost illegible, right? And I'm trying to figure out what names and numbers I'm calling. I have to do the outreach, which is a bit of a pain, and the doctor had to leave the room, write that, and come back. It's additional time, and it's just messy and a little unorganized. You can actually fix that with external triaging as well. You can message the pharmacy and talk about me as a patient and have my record there and all the information. Keeps you organized, and it's on text, so I can definitely read that. Here, I'm skipping ahead a little bit. So I just want to show the final slide here because I feel like I'm going into the product detail a little too much, but the outcome said by Ryan Buffington from Buffington Family Medicine, saving 2 to 3 hours for 3 nurses each day is the equivalent of half of a full-time employee's time that we're getting back each week. And I know that's a mouthful, but the takeaway from this is making your practice more operational efficiency, tying back to all the stuff that Alan is talking about, helps you get more out of the less people that you have, rather than having this environment where you're 30% understaffed and that 70% of people who are in office are getting overwhelmed and taxed, and hey, maybe they leave too, right? Lightening the burden on them so it's easy for them to stick around and do their job. Also improves obviously patient outcomes like we're talking about. In my experience, I can get to my doctor faster. I can have one streamlined communication. I can get that prescription and I can see where I need to go to next via text instead of trying to read that scroll, right? It helps in a million different ways. And from the provider's point of view, this is it. So that's our presentation for today. I talk a little fast, so it's going to be recorded for anybody who wants to review it afterwards. We're going to send it out via email over the next couple of days. And I want to save the last couple of minutes here to open up questions. I know that we got a few. Let's take a look. So first is from Anonymous. So thank you, Anonymous. What would be your biggest piece of advice to a practice that is currently experiencing a staff shortage crisis? Alan, you want to take this one?
Sure. I would honestly say just truly reevaluate like what you need, what you're missing. I would look at what your staffing model was before, what it is currently, kind of what your patient mix is. I would try to think of I would think and be open to new ideas. I think Tele is a great option that I've seen people adopt and others have not. I think what I've seen in the primary care world is people get set on these rigid schedules, and maybe you don't need that rigid schedule. Maybe you could open it to 3 days a week versus 5 days a week, or extend your hours, 3 10-hour days versus 5 8-hour days. So you've got to get flexible. I know we keep bringing that up, but that's the piece that's going to attract and fix what you're trying to solve there, and really look at like, what is it that I need?
Got it. That makes sense. And for me to answer biggest piece of advice for practice that's currently experiencing a staffing shortage, if it's on the administrative side, look at software for sure. All the things that we're talking about, these overwhelming phone calls, the line of patients in front of the admin staff, all the paperwork, the amount of time that people spend scanning documents up into the EHR or listening to voicemails at the end of the day, get that fixed, right? Can save tons of time there and run with less admin staff, or just make the ones who are there more efficient, as we talked about today. Okay, next question. Have you noticed more physicians looking for temporary work instead of permanent? Oh, I think you touched on this a bunch. Want to take this one?
Yeah, I will say like coming out of COVID, and I know we're still in COVID, but really when we started seeing some things open up, that's what that's what all physicians were looking for, was that permanent piece. They wanted a good, comfortable, safe job and what they were looking for. What we are seeing now, though, and it's moving to that flexibility piece, is even the residents coming out of residency, they're not wanting to be tied down to one location. So they are looking for flexible opportunities in different parts of the country. So we're definitely seeing them look more towards that temporary 1099 world versus, hey, I just go in like my dad did, who was a doctor, and I go work at this hospital forever, and this is what I do. And then also Tele is a really big attractive piece for them right now as well.
Gotcha. It looks like we got, oh, I was going to say one more, but now that's two. Do you have any tips for how to keep patients happy and engaged in the midst of a staffing problem? That's a hard one. And I'll let you kick it off if you like, and I'll think about it.
Thanks for letting me have this one.
Take them all.
No, I mean, I think with anything in any business you're in, open and honest communication is key. You can't overpromise something and under deliver. So, and you can't control things that are outside of your control. So, the best to me is just honesty with the patients and being upfront. That would be my advice in anything, though.
Gotcha. And then I'm gonna move to this last one here, and we're gonna call it quits for today. Where should a facility start with a staffing plan if they've never used locums? I assume that's you.
Where should they start? I would say call a few agencies and speak to the teams. Go to their websites. Really, just try to get your questions answered. I mean, the best thing about most locums is they're contingency based. So even if you got down the rabbit hole of getting an agreement in place and opening a search, you're not going to have any costs until you actually bring somebody on board. So I would just maybe reach out to a few agencies with some good credibility and start there.
Got it. Okay, well, I think that's going to wrap us up for today. Alan, thanks for joining. Everyone in the audience, thanks for jumping in. If anyone wants to contact us, information on the bottom here, you can take a quick moment to write it down. I hope you all have an excellent day, and thanks again for your time. Thanks, Alan.
Thanks, Connor. Take care.
Take care.